So now that we have identified the root cause of our problem, we can start to formulate a plan to help remedy the situation. So we can do that with a plan, do, study, act cycle. So for our plan, we can implement new policies to make lines and fluid nursing practice safer. We can do this by requiring oncoming nurses to perform line-to-line tracing after report with the offgoing nurse. So in our unit, we call it line-to-line, and basically you grab the bag at the top of the IV pole, you verify the patient's name and date of birth, you hold the tubing as you leave the bag and you trace it all the way down to the IV pump where you see that it is correctly labeled and set at the appropriate rate. And then you, still holding on to the tubing, trace the line all the way to the patient through the isolette and through all of the patient's other lines that may be running, their EKG leads, their pulse ox. These babies look like spaghetti a lot of the time because of everything that's connected to them, but you physically hold onto the line and you trace it all the way to the patient to make sure that it is running where it needs to run, that it is connected securely, that it's running at the correct rate, that the appropriate fluid is being run, all of those things. And you do this with the offgoing nurse so that you can ask any questions if you have them. So after we implement that, we can compare the rates of line and fluid errors after implementation of the plan to before the implementation of the intervention of the line-to-line tracing. After that, we're going to act. So we studied and compared. We want to make our practice even safer. So now we're going to implement a new standard to dispose of the old fluids and tubing immediately after you hang the bag. So no more leaving it hung up on the IV pole after you've started the new bag. As soon as you are finished with the task, you take the old bag, rip off the patient labels, walk it over to soiled utility, and throw it away. That way, there is no confusion over which bag is actually running and which bag is not.